Hi everyone, I'm Maria and this is my cancer journey. One that I don't think anyone would like to have, but unfortunately we need to deal with the hand that is given to us. So I have received a bunch of questions from you guys, and I realized that I left out some information in my prior videos because frankly, all of a sudden, everything started moving very quickly because I was hospitalized for about 5 days shortly after my biopsy. I did have a biopsy of one of the masses that is in my abdomen, and we got the pathology results back, and it came back as ovarian cancer, but the type of tumor, they call it a Mullerian Carcinosarcoma, otherwise known as a malignant mixed Mullerian tumor. And from what I understand, it's a more difficult tumor to treat because it's not only a carcinoma, but it's a sarcoma. So it arises from two different areas in the body. The tumors are pretty extensive. I have a few large ones, large being over 2 centimeters as they define it. The two largest are around 7+ centimeters, or at least at the last CAT scan, that's what it was. I have tumors in my ovary, my uterus, my peritoneum, and my omentum. So throughout my abdominal cavity, and it's the tumors that are actually causing the buildup in fluid in my abdomen. So as the fluid builds up in the abdomen, I get more pain, and then I need to have it addressed with a paracentesis. So I know the last video I was showing you how much my abdomen had expanded, and I had actually gone to the doctor and he sent me right over to the hospital right away. And I was very thankful that they were able to drain me, because at that point, none of my painkillers could sustain any sort of pain relief for any period of time. And I just being at a number 10 out of 10 in pain for hours is just, it's not sustainable. So with those diagnoses, there's also staging. And so as of right now, my stage is 3C. And I say as of right now is because of all the tumors that are in my abdomen, there was a decision that it didn't make sense to do surgery right away because they wouldn't be able to safely remove all the cancer in the tumors. So I am undergoing 6 rounds of chemotherapy, hopefully, subject to change. And then the plan would be for a major operation that would include a hysterectomy and removal, I believe, of the omentum. But, you know, we haven't gone that far yet, although I have consulted with a gynecological surgical oncologist. And it's definitely important to have someone specialized like that. So as far as prognosis, I haven't asked. What my oncologist has said is it's treatable. And so, as you know, we started to treat it. I wasn't able to get the full chemotherapy for the first round, but I was able to get a full amount of the carboplatin. And so when I had followed up with my doctor, every time before a doctor's visit, they take blood, analyze it, and talk to you about it. I have some great news. My tumor marker went down. They look at the CA-125 tumor marker. So after 1 week after my first chemotherapy session, it went down. Not to a normal amount, but it went down. So that's really good news. The other good news is my liver panel or enzymes there were a lot of issues with that, and those are almost normal. So that's excellent news. The oncologist said that this is indicative that my body is already starting to respond to treatment, which was so important because the cancer was growing so quickly. They really needed to shut it down. Exactly what I'll receive on my next chemotherapy infusion is still in flux. I will be going into Boston, Dana-Farber in Boston, for allergy testing or desensitization to see if they can administer Taxol in a way that doesn't provoke such an anaphylactic reaction as I had before. Hopefully I'll never experience it again. And so that testing will be key to how we move forward and what types of chemotherapy will be used in treating this cancer. What I have learned through this process is that chemotherapy and my treatment is individualized to me. So what I need, they're going to do. And you know, if my body isn't reacting well to one type of chemotherapy, they'll either try to find a way so it's administered so I can take it, or find something else that works for me. So while my plan is not exactly set in stone, that's totally fine with me, because as my treatment goes forward, it's going to depend on these blood tests, on these CAT scans, because I am going to have a CAT scan after a couple of the chemotherapy sessions to make sure that the tumors are shrinking. So in the meantime, I'm just going to do everything and anything possible to give me a leg up on fighting this thing and putting myself in the best position to have to recover from this and to be cancer-free. If you have any questions, just let me know in the comments below. I try to respond to everyone. Sometimes if an answer doesn't make sense, chances are I probably just took a painkiller and I'm a little loopy, but I really want to say how much I appreciate everyone's support. And, you know, words just can't express it. Thanks.